I'm Dr. Johnny Franco. This is Anna, our esthetician, and we're going to talk about non-surgical facial rejuvenation. It's kind of a broad topic, and there's really a whole host of different things that this includes. Everything from your classic Botox, Dysport, as we were talking about earlier, that really affects the upper third of your face, the wrinkles around the eyes, the forehead, can do a little bit of a brow lift. There's lots of people come in and have lines on the lower half of their face, and Botox and Dysport really aren't great for that, in that those work in getting rid of wrinkles by relaxing the muscles, and they don't fill, they don't tighten. So that's where it's a little bit different. And the second category is our fillers, and as we were talking about earlier, there's a huge host of different things that we can do, and we'll get into each one of them differently. This is by no means an all-inclusive group. This is just some of the most popular in a couple of the different categories. There's some broad groups that we use to treat different stuff, and then within each of those there's a few different variations, but we'll try and talk about the most common ones, the most popular ones that we use most commonly. Next is like the ultrasound lasers that we talked about, and Anna will talk about the Ulthera. And you know, a lot of people ask which of these are better, but they really work best in combination, or different people's needs really fit each one better. The Ulthera and the lasers, you know, we talked about, we're getting much better at them, and they're being used better for specific needs. And you'll see, I think we've gotten better at seeing who's going to benefit from these. I think we've gotten better at understanding what they can realistically do, and so we can treat patients' needs and really make stuff better. And then ultimately, there's surgery. And I think it's important to understand that none of these replace surgery, are going to give you the same result as surgery. And for everyone to be ultimately happy, it's really kind of knowing what you can get from each one, and then making a decision about what's best for you and what's going to give you your results. And I think the combination of stuff like Ulthera and fillers really does bridge the gap for a lot of people who are like, you know, I'm not ready for a facelift, I'm not ready for that downtime. Is there something else I can do to bridge me for 5-10 years? And now we have stuff. So
what Ulthera basically is, it does not take the place of a facelift, but it does help tighten your skin and stimulate collagen production. It's a natural way to stimulate your collagen production. It works best on the neck, on the chin, on the eyes, the brows, to open, tighten, lift. It's great for patients that have had surgery and now they feel that years have passed and they need something to help rejuvenate their skin or make it a little bit tauter again. This is a great treatment for that. Or for a patient that is not ready for surgery, they recommend Ulthera or nothing. Again, its goal is to help stimulate your collagen, and by regenerating the new collagen is going to help tighten your skin and lift. It's never going to look as if you had surgery. It is a subtle change, but for some patients it's enough to help get them by for a few more years. It's going to help treat the loose skin. It helps a little bit with the volume of your skin. It's going to help with your fine lines, your skin texture, overall better appearance. There it shows the ages. Everyone benefits from Ulthera because it does help stimulate that collagen. But if what you need is a facelift, then Ulthera is not the treatment for you. What's wonderful about it is non-invasive. There's no downtime with it. It's not like a laser that if you have it done, you can't go out into the sun, because whereas treating is deep down inside. It takes time to see the results. It can take anywhere from 2 to 4 months. So it is a gradual treatment. Usually it's just a one-time treatment. And then everyone is different in the way you take care of your skin, but it can last up to 2 years.
So one-time treatment?
Yes.
Any area in the face?
No, it's not. It's usually you can do your full face and neck. You can do your cheeks, your neck, your eyes.
But let's say you do a full face, that's that one time?
That's one-time treatment, yes.
but remember, everybody's results is different, and just like fillers, like somebody may need more than somebody else, and where you're trying to get to. A lot of people say, yeah, I see a big difference, I think I'm much better, but I'd like to see if I can be a little tighter, a little better. You know, you may want to come back and get...
Second time, third time, if you wanted
And it just really depends. And you'll see here when Anna shows some of these pictures what's realistic to expect and what you can. And that's what she really tries to go over is what's really, you know, what you can get. Because ultimately we want you to be happy and want you to love it. And so, but part of that is knowing what you can and can't get. Mm-hmm.
Okay. So these are different places where it's been advertised. Courtney Cox has had it done, and she's a big advocate for Ulthera, and she's been the latest star to have it done.
And some of our office staff have had it done, so if you have questions about downtime and stuff, you can ask them as well.
So here are some pictures. As you can see, this patient, she looks well. She still has some of the wrinkling, but it's better.
It's a lot better.
This patient looks, I mean, she even looks thinner. Her concern was this. It's definitely much better. It's still there a little bit, but it's a lot less.
How many treatments would, of course,
One,
that particular
one.
patient, that was one treatment,
Yes.
and she received that type of result.
Yes.
But remember, you know, if you have good tone, good skin, this is even just like people who get liposuction. If you have good skin, if you have thin skin, if you've taken care of your skin, if you've done hydration, the chances that you're going to react to this, retract more, is going to be much better than you're someone who's worshipped the sun forever. You got very thin, crepey skin. The chance that your skin's going to retract quite as much, you know, is going to be a little bit different. So that's why, you know, all that stuff plays into.
Yes.
And it should be working better if you're younger, I assume, right?
No.
A little bit, but I mean, a lot of that depends on, you know, you can say that generally, but not, it doesn't, because there's people who have skin who are in their 50s and 60s who've done a good job of it. They're on good regimens. There's good skincare treatments. You know, it's funny. We get lots of people who come in and they're like, what's the best thing I can do for my skin? And we tell them, stop smoking, use sunscreen. And they say, I don't want to do that. What else can I do? But, you know, there's age plays a little bit, but there's a big difference in people who've taken care of their skin, gone on regular regimens, gotten on top of stuff. I mean, and Anna a lot of times tries to get people on the right hydration, the right skincare products. I mean, part of this is the overall package. You know, people come into us and want a facelift, but they don't want to stop smoking. They don't want to get out of the sun. They don't want to do the right stuff. It's almost like, okay, but you're not going to make the overall skin better. And it's a little bit, if you're going to go through all this trouble of doing the Ulthera, facelift, other stuff, you know, do the simple stuff too to really make the result as good as it can be.
I have a question. Let's say that lady said, well, I'm not happy with that. If she came back and did it again after her 90 days, would she have even more of an improvement? Or is that as far as this treatment is going to go?
She would probably get a little bit more tightening, but it wouldn't be anything. No, with Ulthera, it's not dramatic. Usually patients that want to see something dramatic, they need to have surgery if they're a candidate for surgery.
I would consider this a good result.
Yeah.
I mean, if you're going from this to that.
It looks great. I'm just asking, since it's a one-time treatment, if you're not happy, you say, well, maybe a second treatment, but that's not the case. It's just a one-time and...
Well, you can't. Yeah, I mean, you can as long as you're just trying to tweak stuff. But you know, if you're saying, "Oh, I got this far on the first one, I'm going to double my results by doing it again," that's not how it works.
This patient, she still has the skin is still loose, but from where she was to now, she's happy with that. This patient as well. This was her concern. Here, she's much better. A man, we do this on men as well.
And it's really, and for guys, because a lot of guys don't want scars. They don't want an incision on their chin. They don't want the cut behind their ear. They wear their hair short like I do, you know, and so you don't hide these as well. And for men, a lot of times, that they're not looking for the right angle or dramatic change, you know, but they, like here, you can see that now you can kind of see his jawline. Here you couldn't, you know, and especially for a lot of men, this has really been a good option. And you would be absolutely astonished how many men we see in our office now, even compared to 7 years ago, dramatically more, both in terms of getting Botox, fillers, even tummy tucks now in men are extremely more common.
This patient is a lot tighter from where she started. We're showing you these so that you see the changes are subtle. Here's another man. He did well as.
What type of procedure exactly is it? I mean, is it a wand, a laser? How's the
It's
device?
ultrasound, and it has a tip,
Mm-hmm.
and basically that's what we pass through the skin. But it's not a laser.
Do you put a gel on?
We do put a gel on.
Got it.
The nice thing about this, because you have the different layers, and even when you do a facelift, you have the skin, and then you have the little fatty tissue, and then you have the fascia, the strong layer that actually supports all the structure of the face. Part of this is it goes deeper, and it actually tries to scar, with tension in the radio frequency to make that tighten. So that's what lifts from the inside. Rather than burning the skin, it's causing the inside to really lift. And that's why you don't have the skin changes. That's why you don't have the downtime of trying to avoid. There's some other lasers that are great, like CO2 and stuff for skin resurfacing, but like we talked about earlier, people stay red for a while. You have to fight the battles of staying out of the sun. This does a little bit better, and this does better for the internal and the overall kind of lift of.
For you, oh, sorry.
How is this different than thermage? You said that this one here, you should do it every 2 years?
Everyone is different. It's not set in stone that it has to be every 2 years. It could last up to 2 years. It can last longer. You have to reassess. Thermage is radio frequency and is good as well, but it's older technology. This is ultrasound, newer technology, and it does penetrate deeper into the dermis.
And how long did thermage last?
For everyone is different too, a year to 2 years.
Mm-hmm.
And if you've had thermage, you can use this procedure?
Yeah.
Is that a problem?
Yeah, it's not a
Mm-hmm.
problem. In regards to your question before, this patient did have a second treatment, and that was her.
Mm-hmm.
And how long is the procedure?
Depends. If you're doing your full face and neck, it's 2 hours. If it's just your lower face with the neck, it's an hour and a half.
Mm-hmm.
And pain-wise, is it,
It's
compared to
it
thermage?
is a little bit. They're both uncomfortable treatments.
So they're similar?
Yeah.
And we've done both things. Some people take a little bit of pain pills before, and that helps. And then we've actually had other people who've said, I just want to do this under some sedation, and we do it here in our operating room with sedation, and the anesthesiologist make you completely comfortable. So both options are completely available. I would probably do some sedation.
No pain afterwards? No,
Just
it
during the
will
procedure?
be, it's just during the procedure. It will be tender to the touch, and that tenderness can last 3 to 4 weeks.
I'm only saying sedation for me because I'm a baby even with Botox, so my pain threshold's pretty low.
That's another patient. She did get good improvement compared to where she was at. That's why everyone, we have to go by individual. This patient as well, I mean, she looks great. Some patients, after they have the Ulthera, people a few months later will say, oh, have you lost weight? Because it makes their face, like, it shrinks it almost so they look as if they've lost weight.
And I really think with both the Ulthera, the injectables, that type of stuff, you just really want a refreshed, kind of youthful appearance. None of this stuff is going to give you a night and day change. No. And most of the people who want this, that's what they're looking for. They don't want a lot of people to know. They want people to think they look more well-rested, they look more rejuvenated, that type of thing.
Here it is for the brows and for the eyes. Basically what it does, it helps tighten and open the eyes. That's what it does for the eyes. It's not that it's a great combination with that is usually Botox. Goes well with that because Botox will help lift you a little bit more and help with the wrinkling here. Mm-hmm. Again, this patient is more about opening the eye. See how right there? Here it's open. It's not that she doesn't have the skin anymore. It's not that she doesn't have the wrinkles. It's just more open.
Does it help like with frown lines?
No.
No.
It's Botox. Usually with this treatment, it's a great combination. Botox, fillers, that's why we're doing this tonight, Sculptra, all those things go hand in hand. Mm-hmm. It's a complete facial rejuvenation, like Dr. Franco had said.
Any questions about Ulthera?
Well, you mentioned you might not recommend this for somebody if they need a facelift. So what is the determining, other than not smoking and all that stuff?
Right, well first you have to see a physician to make sure if you are a candidate for a facelift or not. The reason why, if what a patient really needs is a facelift, they might go into having the Ulthera done thinking that it's going to take the place of a facelift. So that would be the patient that's not going to be happy with the results because her expectations or his are going to be for a facelift. And this does not take the place of a facelift. It will help rejuvenate your skin and tighten, but it will only get you so far.
Like when I see a patient, if they're showing me and they're saying, you know, I just wish I was just a touch better here, a touch better there, you know, that's the person I think that would really benefit from Ulthera. When I see somebody who pulls and says, I want to look like this, and I want my neck to be like that, you know, I don't recommend Ulthera to them because if their neck is down to here and they want it to be, you know, an L-shaped, it's not going to go from that dramatic change from one to the other. So kind of most people, you can tell which category they're going to go to and what they want to do, partially and mostly by what their goals are and what your goal and where you want to get to. Because they're both good, but they do different things.
Is the procedure done by a doctor or by an esthetician?
By me.
Anna does all the Ulthera. Mm-hmm. You know, if you did it with sedation, then the anesthesiologist would be with you, and so forth.
Did most of those people have sedation?
You know, the majority, yeah, the majority of people don't have sedation. It's just the guys like me who are a little
It's
bit
more comfortable with the sedation,
But I would say 90% of people don't do it. Yeah, yeah. If you've had thermage, if you've had some of the other stuff, you can tolerate this for sure.
No, that's IPL. That's something.
I know, but does it hurt like that?
Maybe a little bit more.
So moving on to other facial rejuvenation, talking about some of the fillers, the neuromodulators. You know, there's a spectrum when we talk about this, and you know, Ulthera's the one part, and now moving to fillers and neuromodulators. There's everything when we talk about facial rejuvenation, from filling the lips that we have become very popular, especially with Valentine's just passing. We did a lot of that. And then, you know, we talked about the wrinkles between your forehead that we treat most commonly. And so there's just a spectrum, and we're going to go through some of those. And stop me if we talk about this, but I wanted to start with aging process because I think Ulthera and all these, they come into play, and I think if you get a better understanding of the aging process, it helps you kind of figure out what's going to treat each person better. And you can see here, just as we age, there's actually specific fat compartments in our face, and that's what falls and causes the folds here, because when those each compartments change, and we used to think years ago that everything just fell. But if you can see here, it's not only that they fall, but they get smaller because we lose volume as we get older. And so that's why the idea that we can either just pull somebody so tight, and that's why, like, even with Ulthera, even if it contracts so much, and old facelifts were used to just pull people so tight, you can't make people look overly youthful without replacing some of that volume, without doing some of that we used to have. And so I think that's really important, and that's really changed over the last few years. And if you see here, this is just kind of going from age to age here. When we're youthful, you got full cheeks and you got a good mid-face, and that's why I say even blush in people, because if you bring out that mid-face, that's what supports your face and keeps everything in a nice, structured, youthful appearance. As that starts to lose volume and fall down, you can see you start to develop your nasolabial folds, your marionette areas, as everything kind of comes down a little bit. And you really, the showing of age is the hollowness that people get in their cheeks. And it's funny because a lot of people come in and they're really worried about their folds here because that's kind of what stands out. But if you don't replace or fill the whole thing as a big picture, that's when you can get the unnatural looks where you're overly full here. Because if you think that I can just fill this line and I'll look young and youthful, that wasn't the problem from the beginning. And that's where you get the fake look, because you've put so much volume in one little line here to try and make that line go away, but you haven't treated the real problem. And I'm not saying that you can't get injections into that area, but you know, it's got to be as part of the bigger picture and the whole treatment. And you can see here, as you're kind of older, now you've completely hollowed in and these folds are down and everything keeps falling. And just from a lateral view, you can really see how your cheeks really start to hollow as you go along. And then that's why everything falls, because you don't have that support. You don't have those cheekbones that are keeping everything up and making people look full and youthful. And from the lateral view, you can just completely see this, where you've hollowed out, everything's fallen, and there's no support. It's like if your frame's fallen, everything else is going to fall too, and just the idea of trying to fill a specific line isn't going to help. And this is why really, you know, stuff like Botox, Dysport, the neuromodulators don't help for the majority of the lower face stuff, because that's a loss of volume. Those really help where you get lines from frowning, from lifting your eyes. That's what the motion, those are what those help with in terms of lines. So to be 20 again, you know, we've talked about this as kind of a big picture. When we're young, we have a good fatty layer, our collagen, our skin is all nice and even because we're filled. And with Ulthera, with some of these other products, it's about rebuilding that collagen or filling that collagen. So how can you recreate your body to make some collagen, some volume to replace this, to make the skin even out so that you don't have the unevenness, you don't have the wrinkles, you can replenish that volume. To not be 20. You lose some of the fat, you get some of the divots because you don't have that collagen, you don't have that structure that's lifting everything up. So if you're going to replace this, if you're going to look youthful, you got to replace one of these. You know, when we do our facelifts, we do a lot of fat grafting because you can just replace the fat that you've lost. You know, if you're not doing surgery, then you can do it with some of these products. You can do it with the tightening. You can do some of these new products actually stimulate your own body to create that collagen, to give you a very natural, soft feel of everything that's just from your own body. And you can see the difference from here where you just lose volume all over. So it's the fat, it's the collagen, it's the combination. And that's why just doing one thing doesn't replace everything. The most common, everybody's heard of Botox. I was talking a little bit earlier before the seminar. One of the great things is for a long time Botox was the only thing out there. And for people who either weren't getting, it wasn't lasting as long for them, it wasn't working as well for them, they didn't have any other choice. One of the new products out is Dysport. And it's great in that it just gives people another option. If Botox maybe isn't lasting long enough for you, some people, the Dysport actually lasts longer for them. So it gives people another option, an alternative to try something else. And it's hard to predict which one's going to work better for each person. So typically what I do is we start with one or the other, and then if it's not working, then we try the other one. Or people who come in and say, you know, I've had the Botox, I love it, it doesn't last me as long as it used to. We switch, and a lot of people have seen good results from that. The Dysport does onset a little bit faster, so not that any of us plan things at the last minute, but if you come in and you have something a week, the Dysport does take effect a little bit faster than the Botox. But both of them still take a little bit of time, and that's why they're nice in terms of a natural look, is that you don't get a result right away. You get it, and then slowly it weakens the muscles and the lines even out over time. And with both of them, your results actually get better over time. The longer you decrease that action motion from the muscles causing those wrinkles and lines, the better the wrinkles get. And so people actually look better after their second or third treatment than their first treatment. And you can see here, you know, the purpose isn't to make people look frozen or over. It's just, here's the lines you get from your muscles contracting. It's just to smooth that out. And here we really try to do the entire face as one treatment, because you can do a lot of things. If you're not just trying to treat each wrinkle, again, if you're trying to do the big picture, you can lift the brows, you can do some shaping that really makes it a nice overall result. And the idea that you have to be frozen or unnatural is not true. You know, everyone in our office has it, and I don't think any of them look frozen or unnatural. I want them to still know when I'm mad at them, so you know we won't completely freeze our forehead. One of the most common and most popular fillers is hyaluronic acid, because this is a natural material that's found in your body. The nice thing about this is it's very soft. You can use it in a lot of areas. Classically, this is the one that's used in the folds, used for lips. You can use it to touch up little areas where you need a little bit of volume, contour, deformities. There's a lot of stuff, especially here in Miami. People, you know, don't like the fact that this only lasts 6-9 months. But one of the nice things is that if for some reason you didn't like it, there's actually something you can inject that makes it go away instantly. So it takes some of the fear out of it. Two, it's a naturally occurring product, so you don't have problems with infection, other types of stuff like that. Unfortunately, because of Miami and the different stuff that goes on here, we see a lot of people who get silicone, biopolymer, some of these foreign substances because they want something that lasts forever. And if you have a problem, it becomes very difficult to treat. So that's my 2 cents about being careful.
Juvederm, what do you say about that?
Juvederm's in this category. It's basically equivalent to the Restylane. I think it's a good product. Like I said, there's tons of products that are on these, so I just picked a few that, but Juvederm, Restylane are probably the two in this category, are the two most common. They're very good for lips, folds. All the hyaluronic acids last about 6 to 9 months. You know, but it's not like at 9 months, it just goes away. You know, you fill them, and then after about 6 to 9 months, it gradually starts to fade out. And so, you know, maybe a year later, you come back, you do a little bit, and just kind of, you know, it's about tweaking, and you'll see that, you know, if you wait or you want to come in and get everything filled up just completely, then that's when you start getting into problems. It's getting you a good base, and then just a little touch up here and there to kind of maintenance. You know, this is the Restylane. People worry about lips, you know, but you can actually make somebody look very natural with just a little bit of injecting in the lips or different type stuff. And that's where I think Restylane and the hyaluronic acids are really great in terms of just small amount of fill, just getting a little bit, making stuff look subtle and natural. You know, Sculptra is one of the new products that's really kind of come out, and this is one of the new type of drugs in that it just stimulates your own body to make your own collagen. So you get injected, and kind of like the Ulthera, you do have to have a little bit of patience because you get the volume and a quick preview of what you're going to look like from the injections, but then your body absorbs that, and then it builds its own collagen over the next 6 to 8 weeks. And so, and this is really a nice thing for people who are very thin, very health conscious, who work out a lot, are kind of our most common. So a lot of even personal trainers, that type of people, because they become very hollow. And you can refill the cheeks. You can give people a really nice natural, and you can see as you go from each spot, you get a little bit more full, and just fill in the cheeks, making those lines get a little bit better. And this is nice because it's a very liquid stuff that you can put evenly spread out and give a nice even contour. Unlike with the, you know, a little different than the Juvederm or Restylane, because that's a thicker that you put in a specific area. This you can actually kind of fill the whole cheeks and give a nice volume to. But again, you know, if you have something in 2 weeks, this probably isn't the best product for you. If you're looking for something very natural and subtle, this is great because it takes effect over a couple of weeks. And so, you know, no one's going to say, oh, you had something done, because especially if they're seeing you all the time, it's just gradually. And it's pretty classic where a lot of times people can be like, oh, I didn't see that much of a result. They come in and they look at their before picture and they're like, wow, I look pretty good. Because when we see ourselves every day, we don't notice it. And then when you see something from 2 months ago, you're like, wow, I look very good.
Can you use this like in combination with the Ultra?
With like the Ulthera or the...
Ulthera.
Yeah, you can. I wouldn't do it at the same time, you know, because I would worry that the Ulthera with the radio frequency would ruin some of the Sculptra. So I would do the Ulthera, and then maybe wait a month, and then you can do the Sculptra. I wouldn't do them in the same day. Plus, if she's doing the probes, you can move some of the stuff around, and we kind of want it to be where it's going to be. And yeah, I wouldn't do them at the same day, but definitely people do better in combination for sure. Here's a before and someone thin, and some of you may know her. She's one of our estheticians, but you can see she's a classic person who benefits from this because she's very thin. And you can see just, you know, very pretty, but a little bit of hollowness. You can see the hollowness here on each chin. And so it's just how do you kind of fill that in a subtle, natural way? Because people who have a little bit of fat, you can put more stuff in here and people aren't going to see it. But if you're very thin, you got to be careful what you inject because you can feel some of the unevenness. You can see some of that, so you got to be careful. And that's why in thin people, I think the Sculptra is very good. And you can see here after, you know, her lines are gone. She has more of an even chin. She has, and she just received one treatment. You know, you probably could even get away with doing another treatment on her, but I think she has very nice cheekbones. I think she has very nice fullness, but still looks very natural. Doesn't look overly full. Doesn't look uneven. And you can see the difference here, where she's hollow here. She has divots here, and now she has kind of a nice jaw. She has some fullness to her cheeks, which just gives it a nice overall youthful appearance. And you can see how without even injecting anything, you can kind of fill the face without going after every little line. And I think going after every little line, you start to get yourself in trouble, and you don't give a good big picture. Radius is another product which is a nice volumizer for people who just need more volume, more cheeks, that type of stuff. The nice benefit that it has is that you get a result right away. So people who have something a week, 2 weeks, you can't spread it quite as far all the way out around the face like you can the Sculptra, and you do get more of an immediate result. So for some people that's very good. For some people who kind of want it to be a little bit more subtle, no one to notice, they may prefer the Sculptra. But I think they're both good options for people. And you can see here, you know, here's someone who, she had gotten 2 treatments of this, but you can see she had very thick lines, she had some hollowness, And by just filling in her cheeks, it really made her folds get a lot better. And the goal is not to make these lines go completely away, because even as a child, even as a young person, you still have some. And if you try and fill somebody so much that don't have any lines, it doesn't look natural. It just really doesn't. And so you got to have a little bit. But I think overall she looks very young, very youthful. You know, you can see even a better kind of fold to her chin and jaw. Here's another one. This is Nora, one of our fabulous front desk people, and you can see the hollowness that she has in her cheeks a little bit, some of the emptiness, and just a more youthful, full kind of cheek appearance that you can see. And this was just one treatment, and so I think it's just a nice overall appearance. Questions that anybody has? I know that was a lot of stuff pretty fast, but I don't want to keep you too late. Questions about any of the products, any of the stuff, Ulthera, the injectables? All right. Well, I appreciate everyone coming out tonight. Thank you so much.